National Infectious Disease Management in Republic of Korea. Hello, this is Dong-Han Lee, Director for the Division of Infectious Disease Control of the Korea Disease Control and Prevention Agency. In this time, I'd like to explain National Infectious Disease Management in the Republic of Korea. This course will focus on the National Infectious Disease Management in the Republic of Korea. It will provide National Infectious Disease Surveillance System, National Tuberculosis Elimination Project, National Immunization Program, the experiences to respond to past epidemic by KDCA, and Surveillance and Outbreak Investigation of COVID-19 to give you insight for policymaking on national infectious disease management. The course is comprised of National Infectious Disease Management and Surveillance System, National Tuberculosis Elimination Project, and National Immunization Program. In addition, the most important part in this lecture is how Korea responded to past epidemics and the surveillance and outbreak investigation of COVID-19. Then, finally, we will look over on the way forward. The course objectives are to understand the National Infectious Disease Management and Surveillance System in the Republic of Korea and share the experiences of National Tuberculosis Elimination Project, National Immunization Program, how to respond to epidemic cases, and the surveillance, outbreak investigation of COVID-19 and way forward. It is extremely important to prevent and manage infectious diseases at a national level. An infectious disease can spread in an instant. Hence, if the number of confirmed cases increases, first, secondary infection due to index patients begins. Second, not only medical costs for treatment of the disease, but also economic damage increases. Third, as the number of infected patients increases, patients who need to be treated and taken care of due to other diseases aren't able to receive medical treatment. Lastly, a national security crisis results from infectious diseases abroad. This graph is showing the number of reported infectious disease cases in Korea for several years. From 2000 to 2001, there was an outbreak of measles. More than 50,000 cases were reported. And from 2009 to 2010, there was an influenza, a H1N1 pandemic. Also, there was a public health crisis caused by MERS in 2015. Also, there were measles and hepatitis A outbreaks reported in 2019. Then, the current deadly COVID-19 has broken out. Now, let us move on how the Korean government responds to infectious diseases. First, we look over to the Korea Disease Control and Prevention Agency that keeps Korea secure from disease threats by strengthening public health emergency response capacity. The KDCA is composed of 8 bureaus. Also, Korea National Institute of Health, Regional Centers for Disease Control and Prevention, Nation Quarantine Station, and National Tuberculosis Hospitals are under KDCA. 1,470 public officers work in KDCA. Actually, KDCA was the organization under the Ministry of Health and Welfare not too long ago. The Centers for Disease Control and Prevention was elevated to the Korea Disease Control and Prevention Agency in September 2020 in order to respond swiftly and effectively to the outbreak of emerging infectious diseases. The KDCA has responsibilities for policy establishment and execution, as well as plans the budget and operates personnel and organization independently. In addition, it can exercise actual authority over the establishment and execution of infectious diseases management policies. Moreover, it is able to establish regional centers for disease control and prevention, which carry out epidemiological investigations at regional sites, disease survey and analysis by region at all times, and support the prevention function of the community. The following are details of Korea's infectious disease management policy. The government established supporting organizations for infectious diseases, as well as epidemiological investigation teams in all metropolitan cities and provinces, so that disease control and prevention is possible nationwide. Moreover, the government established an Emergency Operations Center, so that information collection, propagation, comprehensive management of an emerging infectious disease is possible. And the government designated notifiable diseases, classified them depending on their characteristic, and determined the severity, transmissibility, isolation level, and reporting time of the infectious diseases. For example, for grade 1 infectious disease, It has to be reported the moment it is identified. Let's look into notifiable diseases in more details in the next slide. Moreover, the government established a basic plan for the infectious disease prevention and control, set macroscopic national goals for the next 5 years related to the prevention and control of infectious diseases, explore future directions, and try to achieve goals. The major details are as follows in the slide. The data of infectious disease is disseminated through Disease Web Statistics System, Public Health Weekly Report, and Infectious Disease Surveillance Yearbook. In Korea, National Notifiable Infectious Disease is composed of 4 grades. The Grade 1 infectious disease is the infectious diseases that spread through bioterrorism or infectious diseases with a high mortality rate or a high risk of mass outbreak, requiring immediate reporting and high-level isolation, such as Ebola, SARS, MERS, et al. Also, Corona-19 is managed as an emerging infectious disease syndrome, Grade 1 infectious disease. The Grade 1 infectious disease is the infectious diseases that shall be reported within 24 hours of outbreak or epidemic in consideration of the possibility of transmission and require isolation. Waterborne or foodborne infectious disease and respiratory infectious disease is Grade 2 infectious disease. The Grade 3 infectious disease is the infectious diseases that requires continuous surveillance, such as zoonosis, vector-borne disease. The Grade 3 infectious disease is the infectious diseases that requires sentinel surveillance to investigate whether they are epidemic, such as influenza. A medical doctor or Oriental medical doctor shall report such fact to the head of the medical institution to which he or she belongs, and shall instruct the relevant patient and his or her cohabitants how to prevent infections when he or she diagnoses a patient, etc., of an infectious disease, or examines the corpse of such patient. Where a staff member discovers a patient, etc., of an infectious disease through a laboratory test, etc., he or she shall report such fact to the head of the institution. The head of a medical institution and the head of an institution for confirming pathogens notify the Minister of Health and Welfare or the governor of the competent public health center, excluding cases caused by an infectious disease subject to sentinel surveillance, immediately in cases of Grade 1 infectious diseases, within 24 hours in cases of Grade 2 and 3 infectious diseases. The director of a public health center in receipt of a report made shall report the details thereof to the governor of city or a county, who shall in turn report the same to the Minister of Health and Welfare and the mayor of metropolitan or the governor of a province. This is the direction of strengthening measures of TB prevention management. To make the society without tuberculosis, the main strategy is prevention and early detection of tuberculosis, patient care and contact management, expansion of TB R&D, and management of essential materials, and strengthening the response system of tuberculosis. The Public Health Center may order the patients with MDR-TB, patients with poor compliance, to be hospitalized at a medical institution. These patients should visit the Public Health Center daily to check taking anti-TB agent after discharging the hospital. The local government shall take necessary measures to sustain the livelihood of the patient or his or her dependents, such as subsidization of expenses. Elderly with medical care assistance or bedridden elderly is screened for TB. TB management program for the homeless is operated. The government support the hospital the wage of nurses who are exclusively responsible for the TB patient's management. All family members of the patients are investigated. Outbreak investigation is performed when a patient is reported in the group facility, such as school, company, or social welfare facilities. The cost is supported by the National Health Insurance. The investigation is composed of TB screening, such as chest X-ray, sputum smear culture or TB-PCR, and latent TB screening such as skin test or IgRA. Children under 12 years of age can be supported for all immunization costs of government-designated vaccines when he or she is vaccinated at the public health center or private clinic. When children enter elementary school or students enter middle school, the head of an elementary school and the head of a secondary school shall receive certificates of vaccination from the head of a city or county through immunization registry system within 90 days from the date when the students enter a school, and inspect whether the students have had all the vaccinations provided in the Infectious Disease Control and Prevention Act, and then record them in the Educational Information System. The head of an elementary school and the head of a secondary school shall guide the students who, it turns out after inspection, haven't had all the vaccinations, to have vaccinations and, if necessary, may ask the head of a relevant public health center for necessary cooperation, such as assistance for vaccinations. When a pregnant woman has hepatitis surface antigen, the government supports the cost for the hepatitis B immunoglobulin, 3 doses of hepatitis B vaccine, and HBsAg and anti-HBs testing for all infants born to HBsAg positive mothers. In 2003, there was a SARS outbreak. We operated 24-hour emergency working system and secured hospital beds for isolated treatment. Also, we tested and traced all people entering from risk areas. After the outbreak, the Korean government established KCDC, and quarantine and disease prevention and control functions were unified to KCDC. This is the main strategy for the response of pandemic novel influenza H1N1 in 2019. In the early stage, the main strategy was containment, such as quarantine and isolation. After community outbreak was detected, we changed the strategy from containment to mitigation, such as antiviral agent treatment and vaccination. These are the policies for the response to H1N1 pandemic. After the pandemic, additional budget was secured to establish isolated ICUs in hospitals, isolated facilities in nation quarantine stations, etc. The outbreak of MERS-CoV infection was reported in Korea in 2015. A total of 186 confirmed patients with MERS-CoV infection across 16 hospitals were identified in the Republic of Korea. Also, 38 fatal cases were reported. 44.1% of the cases were patients exposed in hospitals, 32.8% were caregivers, and 13.4% were healthcare personnel. The graph shows the epidemiologic curve of 178 confirmed cases of Middle East Respiratory Syndrome coronavirus, MERS-CoV infection, in the Republic of Korea, 2015. Panel A, integrated curve, depicts the overall epidemiologic curve by date of symptom onset. The red color indicates the patient index, and 3 main clusters, Hospital C, Hospital H, and Hospital M and N, are depicted with yellow, green, and purple, respectively. The MERS outbreak in 2015 was mostly hospital-based outbreak. KCDC performed the extensive laboratory tests, preemptive isolation, continuous reflection, and promotion based on the results through after-action review of response on MERS suspected cases reported. After MERS outbreak in 2015, KCDC revised the Public Health Crisis Response System. KCDC made Smart Quarantine System, the Emergency Operations Center, Field Response Team, and Risk Communication Team, and expanded the Negative Pressure Room, FETP staff. Also, the government restricted the patient's number of inpatient rooms and introduced the Comprehensive Nursing Service. The EOC operates 24/7 to receive notifications and collect information on emerging and re-emerging infectious diseases, such as MERS and COVID-19, that can cause public health crises. The EOC manages outbreak situations to make sure that infections are properly handled according to the pre-distributed guidelines for specific infectious diseases. The main functions of EOC is information gathering, regular response, rapid dissemination, and emergency response. This is the timeline of response on COVID-19 pandemic in Korea. The first case was detected on January 20th, and the government raised the alert level. Community outbreak was detected in mid-February, and the government raised the alert level to the highest. You can see more detailed timeline in the next lecture. In the COVID-19 response, the patient is detected through epidemiological investigation, lab testing, special entry procedure, and self-diagnostic application. The patient is classified and treated in the facility or hospital. Since the 1st of April 2020, all travelers entering Korea should be quarantined for 14 days from the day after arrival and monitored for symptom onset. Also, community-based surveillance is performed in the hospital, clinic, and public health center. For contact tracing, the EIS officer interviews the patient and reviews the medical records, phone location information, card transaction log, and CCTV. Close contact was restricted at home and monitored for symptom onset. The policy direction for preparedness and control of any infectious diseases is as follows. The first is to manage the national prevention system during the whole period. The national defense system against infectious diseases can be divided into 4 categories, including prevention of inflow, on-site response, infection route, and prevention of spread. First, it is prevention of inflow. Since infectious disease outbreaks occur worldwide, an international infectious disease epidemic information sharing system will be established to monitor the situation and provide information at all times. Second, infection route. We will establish stronger prevention strategy by strengthening the infectious disease prevention and control system of the transmission route based on the analysis of the confirmed patient's route through an epidemiological investigation. In addition, the transmission routes of the confirmed patients will be provided to the public in order to prevent secondary infection. Moreover, to prevent infection in medical institutions, healthcare workers will be trained, and technologies such as drive-through testing that can prevent infections within hospitals will be supported. Third, field response. We also will prepare for a novel infectious disease by developing a response manual that can be used immediately when outbreak of the infectious disease. In addition, we will provide information and ways to prevent emerging infectious diseases for the public through websites, etc., so that the public can receive accurate information on time. Moreover, we will make expert lists, including physicians, epidemiologists, administrative specialists to be formed so that we can provide policies on novel infectious diseases swiftly. Lastly, prevention of spread. We will study and develop infectious disease treatments, disinfectants, and prevention devices, as well as transfer systematic prevention techniques to each institution. The next strategy is the establishment of a research and management system for infectious diseases. The role of disease control is divided into R&D and control and response. The roles are allocated by deciding the organizations in charge. The details are as follows. That's all I'm prepared to explain to you. Thanks for listening.